Hello and welcome. Today we are going to talk about something that affects many people but is rarely discussed openly: hemorrhoids. If you are watching this, you might be seeking relief for yourself or a loved one. So don't worry, you are not alone. We will walk through the causes, symptoms, and most importantly, treatments so you can feel better, equipped to the manage hemorrhoids and regain your comfort. Hemorrhoids are swollen veins in the lower part of the rectum or anus. They can be internal, inside the rectum, which are usually painless, or external, which occur around the anus and can be more painful. So, what causes them? Common culprits include straining during the bowel movements, chronic constipation, and even pregnancy, as the increased pressure on the pelvic area can lead to hemorrhoids. Sitting for longer period of time, or eating a low fiber diet can also play a big role. But don't worry, while hemorrhoids are uncomfortable, they are treatable. So, how do you know if you have hemorrhoids? Common symptoms include itching, discomfort, or even bleeding during the bowel movements. External hemorrhoids can cause swelling and form a lump around the anus. Internal ones may bleed but are usually painless. If you notice severe pain or bleeding that does not go away with home treatments, it's time to see a doctor, especially if you experience any changes in bowel habits or stool color. Early detection can prevent complications. Let's talk about the treatments. Many mild cases of hemorrhoids can be managed at home. One of the most soothing remedies is a siege bath. Sitting in warm water for about 10 to 15 minutes can reduce irritation and swelling. You can also use over the counter creams or wipes specifically designed for hemorrhoids, or apply ice packs to ease swelling. Be gentle with the area, use soft toilet paper or moist wipes, and try to avoid straining when using the bathroom. Hydration and diet also play a huge role. Drinking plenty of water and eating fiber rich foods like fruits, vegetables, and whole grains can help soften stools, making bowel movements easier. For those of you who prefer natural remedies, there are some great options. Witch hazel is one of the most common or most popular. It's a natural astringent that helps reduce irritation and inflammation. Aloe vera can be applied topically for its soothing and anti inflammatory properties. Epsom salt baths are also effective in reducing the pain and swelling. Some people find relief by using diluted essential oils like tea tree or lavender, though be sure to use them carefully and never apply them directly without dilution. If home remedies and lifestyle changes don't bring you the relief you need, don't worry, there are effective medical treatments available. One of the most common treatments for internal hemorrhoids is rubber band ligation. In this procedure, a doctor places teeny rubber bands around the base of the hemorrhoid. By cutting off its blood supply, the hemorrhoid eventually shrinks and fall off. This is often an outpatient procedure, meaning you can go home the same day and it's relatively painless. Another option is sclerotherapy, where a chemical solution is injected directly into the hemorrhoid. This solution causes the blood vessels to collapse, shrinking the hemorrhoid. It is specifically useful for smaller internal hemorrhoids that have not responded to home remedies. For those looking for a more advanced, minimally invasive approach, coagulation therapy may be used. Techniques like infrared, laser, or bipolar coagulation work by hardening and shrinking the hemorrhoid tissue. These methods are typically quick and have minimal downtime, allowing you to get back to your daily life faster. In more severe cases, particularly with large or recurring hemorrhoids, a hemorrhoidectomy may be necessary. This surgical procedure involves the complete removal of hemorrhoidal tissues. While it may sound daunting, it offers the highest success rate, and it usually reserved for cases where other treatments have not worked. The recovery may take a few weeks, but for many, it offers lasting relief from painful symptoms. Another surgical option is stapled hemorrhoidopexy. This procedure is typically used for prolapsed hemorrhoids, where the tissue is pushed out of the anus. The surgeon uses a stapling device to reposition the hemorrhoids and cut off their blood supply, which causes them to shrink. This method typically involves less pain and faster recovery compared to a traditional hemorrhoidectomy. With all these options available, you don't have to suffer in silence. Your doctor will help you choose the best treatment based on the severity of your conditions and your personal comfort level. So, hemorrhoids during pregnancy are quite common, especially in the latter stages when the growing uterus starts putting significant pressure on the veins in the lower rectum. Hormonal changes, specifically the increase in progesterone, also cause blood vessels to relax, which contributes to the development of hemorrhoids. Constipation is another major factor, often worsened by prenatal vitamins and specifically those high in iron. Pregnancy related hemorrhoids can often occur in the third trimester when the baby's weight presses down on the pelvic area. While this can be uncomfortable, there are many safe remedies you can try. A high fiber diet, including foods like whole grains, fruits, and leafy vegetables, can help prevent constipation and make bowel movements easier. Staying hydrated by drinking plenty of water is essential as well. Gentle physical activity like walking can also help keep things moving and reduce pressure in the pelvic area. But if like the hemorrhoids become too much painful or causing bleeding, it's important to consult with your healthcare provider to ensure the right treatment. For those experiencing severe or persistent hemorrhoids, surgery may be the best option to find relief. There are different surgical procedures available depending on the severity of the hemorrhoids. Hemorrhoidectomy, which involves surgically removing the hemorrhoid, is the most effective and is typically recommended for the larger or recurrent hemorrhoids. Stapling is another option that cuts off the blood supply or blood flow to the hemorrhoid tissue, which eventually shrinks and fall off. Rubber band ligation or banding is a minimally invasive procedure that occurs similarly by placing a small band around the hemorrhoid to cut off the blood supply. Recovery from hemorrhoid surgery requires some patience and careful attention to the healing procedure. Rest is crucial during the initial days after surgery. Avoid any heavy lifting or straining to allow the area to heal properly. If you likely experience some pain or discomfort, but siege baths or ice packs and pain medications prescribed by your doctor can provide relief. It's important to follow the doctor's post-operative instruction carefully, which will likely include tips for keeping the area clean, managing discomfort, and adapting a high fiber diet to avoid constipation and prevent the recurrence of hemorrhoids. Remember, while surgery can provide long term relief, it's still essential to maintain good bowel habits and a healthy diet to prevent hemorrhoids from returning. Eating a high fiber diet, staying hydrated, and avoiding prolonged sitting or straining during bowel movements are all the key strategies. So, as we wrap up, let's answer some common questions I often hear about hemorrhoids. Will hemorrhoids go away on their own? Yes, mild cases can improve on their own, especially with lifestyle changes like eating a high fiber rich diet and staying hydrated. However, more severe hemorrhoids may require medical interventions. How long do hemorrhoids last? This really depends on the severity. For minor hemorrhoids, symptoms can improve within a few days with proper care. Larger hemorrhoids or those requiring surgery can take weeks to fully dissolve. Can hemorrhoids come back after treatment? Unfortunately, yes. Hemorrhoids can recur if the underlying causes like straining during bowel movements, chronic constipation, or low fiber diet are not addressed. This is why prevention is the key. Are there permanent solutions? Medical treatments like rubber band ligation or surgery offer long term relief, and they are not guaranteed to prevent future hemorrhoids. Maintaining good bowel habits and a healthy lifestyle will significantly reduce your chances of recurrence. How can I prevent hemorrhoids in the future? Prevention is all about staying regular. Keep your stool soft by drinking plenty of water, eating high fiber foods, and exercise regularly. Avoid sitting for longer periods of time and don't strain when you go to bathroom. Thank you so much for joining me and watching this. I hope this video has answered all your questions and provided the information you need to find relief and prevent future hemorrhoids. Stay healthy and remember to consult your doctor if you have any persistent symptoms.